Hi, I'm Dr. Folashade Farri. I'm a pediatric pulmonologist. Today, I'm here to answer some of the questions that parents have about asthma. Let's get into it.
What is asthma?
The first one is usually, what is asthma? So asthma is a chronic condition that predisposes exaggerated reactions and inflammation in the airways and the lungs. What this looks like inside the lungs is excessive mucus production, is exaggerated swelling of the actual inside lining of the tissue, difficulty with mucus moving around effectively, and ultimately it can impair the ability of the lungs to move oxygen in and out. But how does it manifest? The common symptoms of asthma include cough, wheezing, trouble breathing, chest pain or chest tightness. Let me say this because it's important to clarify. There's no one symptom that equals asthma. So a child who has a wheeze may not have asthma, and a child with asthma may not have a wheeze. Okay.
When should I be concerned about asthma?
Yes, so another question that we often get is, so tell me, what should be concerning? When should I be concerned? When should I worry? So, like I just mentioned, the symptoms that we briefly discussed, cough, may tend to come in prolonged or exaggerated fits. It may be worse with certain circumstances, with activity, during viral illnesses. It may be worse at particular times of the day. Also, there may be trouble breathing that is exaggerated when a child is intensely active during sports, gym, and school. There may be a seasonal variation to it, where symptoms are worse or pronounced or show up mostly at particular times of the year, sometimes in the spring, summer. All the varieties exist. And lastly, it may have other factors that come with it. So some people have allergies and asthma. Some people have allergies but no asthma. Some people have asthma despite not having allergies.
How do you diagnose asthma?
So, yes, this is also a question. So, how do we diagnose it? So the important thing to first say is that each diagnosis will be based on particular circumstances. There's no one symptom that means asthma, and there's no one use of a particular medication or particular picture. So it's going to be very important that we know who your child is, what these episodes have been, what particular symptoms are going on, how long they've been. So a thorough history. A physical exam, noting some things that we hear, that we see, or things we don't see. And then many children, especially when they are old enough, will do specific lung function tests. Some of them are appropriate. We have those in our office for kids as young as 4, can do specific tests that further help us to diagnose. And lastly, it's very important to put context into each diagnosis. So, this is not something we piece together or make up at home. Getting a proper evaluation at the doctor's office and getting monitoring over time. And when necessary, getting proper lung function tests is the ideal way to diagnose asthma.
Are steroids safe for children with asthma?
So this is often another question that we get. A lot of parents are concerned, and we understand the concern about what's this medication. So the first thing to say is that the steroids used in asthma are different from the steroids that people used to often hear about when we talk about athletes and people talk about anabolic steroids. The next thing to say is that The dose and the method of use is done in a way that is appropriate and administered in the safest possible way. The third thing to say is that the preventative use of micromilligrams of inhaled steroids is actually much safer than letting things worsen and become an emergency where we then have to use a much larger, in the thousandth proportion, dose of a systemic, which means the steroid goes to all of the body, versus when we use it targeted, going straight to the lungs as much as possible. The last thing to say is follow-up is then ideal, because we want to know when a child needs a particular medication. When they don't, we take it off. If we are concerned about a side effect, we can modify our treatment.
Are there non-steroid options?
And lastly, yes, this is an important question. Are there non-steroid options? Absolutely. Those medicines exist, but again, it will depend on each child and their risk factors. There are medications that are steroid-free and come in different forms that certain children may need as adjunct therapy.
Are inhalers addictive for children?
Another one. No. Inhalers are not addictive. They work if we use them appropriately with spacers. They work at targeted sites. The body clears them over time. And we follow the recommended guidelines in escalating or weaning off medications and making sure that we use them safely.
What does your pediatric asthma program offer?
Yes, absolutely. We can help. That's why we're here. At C.L.A.P.S MD, we provide comprehensive evaluation so we're arriving at the right diagnosis. We also provide a personalized treatment plan, so it's not off the shelf. It's particularly tailored to the needs of your child. We're constantly following up to decrease medications when we see the need for them decreases. We also provide the latest evidence-based medicines, access to it, including, when appropriate for some children, non-steroid long-term medications. We're constantly providing education. We believe that health education holds the key to promoting optimal lung health. And so we're teaching identifying risks, we're teaching inhaler technique, we're teaching the importance of responding appropriately during flare-ups, and we're teaching modifying treatment regimens throughout the year. Lastly, for patients who, when it's appropriate and when it fits, we provide access to remote patient monitoring, where even outside of the visits, we have access to evaluating how your child's lung health is doing. We're here to support you, and so education and collaboration, conversations, follow-up visits, all are part of what we do here to optimize your child's long-term health and making sure that they breathe, they thrive, and they can do every single thing they're interested in. So if you have questions about a child's respiratory diagnosis, if you have need for support for ongoing management of asthma, if you need formal lung function testing, give us a call. Visit us online. You can request appointments from our website, and we'll be sure to provide you support and answers. That's why we're here.